Is Deputy Denis Naughten to the Minister of Health the need to review the operations of the Acute Psychiatric unit at the Universal Hospital Galway following the recent internal audit. The Deputy has 4 minutes.
Thank you, Cathaoirleach, and welcome the opportunity to speak on this. And can I thank the Can Corla for selecting me, and can I thank the Minister for being present in the House on this important issue. Cathaoirleach, there's been a litany of failures identified in an internal health and safety audit that was carried out of the Acute Psychiatric unit at Galway University Hospital on the 4th of June last. And having read that report, it's clear that it is an accident waiting to happen. The report points out that 1/5 of the staff are not complying with mandatory training in aggression and in violence. The report goes on to state that as a result of recent cost containment, not all staff have attended or been given the opportunity to attend the mandatory training. The report also highlights problems with the conditions of the facility. There's the perennial problem with the leaks in the roof, which led, and I quote from the report, to a watermark close to electrical connections at one location. And it goes on to highlight that the bed has been removed in another part of the unit because of the leaking roof. But it's not just one bed. A number of beds have been moved over the last 6 months because of an ongoing problem with the leaking roof. One of these particular beds is in the women's ward, and it's known as the bed with a bucket. Patients have to use towels and sheets on the floor to soak up the drip, rather than having to listen to the continuous drip, 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 drip into a bucket. Now, Minister, if that was being done in Guantanamo Bay, it wouldn't be acceptable, and yet it is happening in an acute psychiatric unit in this country at the moment. And the patients have to ask some of the other patients in the ward, has anyone got another towel to try and soak up the perennial flood of water that's coming through the roof? In one particular occasion, one of the patients in that bed moved it away from the drip, and actually it was partially blocking the door into one of the 2 toilets on the women's ward that is there to accommodate 16 women. But it's not just the quality of facilities, it's the lack of facilities, particularly for activities within the unit as well, to actually help and prevent patient boredom. As one patient put it to me, there's nothing to do but sit around waiting for medication. Stay in your bed or go for a cigarette. They're the only 2 options that you have, because staff are literally run off their feet, particularly dealing with specials, which are patients that require one-to-one care because they're either a risk to themselves or a risk to others. And because of the lack of staff support in that unit, many patients are being forced into involuntary situations where they have to remain in that unit. And I understand at present, within that unit, why the national average for involuntary patients is running at about 11%. In the acute unit in Galway at the moment, it's closer to 50%. Now, that in itself should be setting off alarms. One particular patient that I spoke to that had spent a period of time in the high-risk ward told me that they spent 2 to 3 days without speaking with a nurse in a high-risk ward because the nurses were so busy dealing with patients who required one-to-one care, including one forensic patient who is in that acute ward who shouldn't be accommodated in an acute psychiatric ward, and because of the lack of staff available to monitor that patient, that individual has on occasion been able to roam freely throughout the unit. Minister, there is not adequate staff in the unit, and that combined with the building that's totally inadequate, along with the reports of patient boredom, is a recipe for a serious accident happening in that unit at present.
Thank you, Deputy Minister.
Thank you very much, and I'm taking this matter for Minister Lynch, who is indisposed. I'd like to thank the Deputy for raising this important issue and giving me the opportunity to give an update on the matter to the House. The HSE is proceeding to modernise and reform mental health services right across the HSE and HSE West, including the Galway-Roscommon area. A key factor in this reform was the recognition that the previous overall stock of 79 psychiatric beds across Galway-Roscommon was in fact too high, based on recommendations in a vision for change, allied to a corresponding underdevelopment of community-based mental health services, where I believe we would all wish to see the service. In this context, an implementation plan to reconfigure mental health services across the Galway-Roscommon administrative area was put in place, culminating in the closure of the psychiatric ward in St Bridget's, Ballinasloe, and the transfer of beds from there on a phased basis to the acute psychiatric unit in Galway. Since February, a bed capacity level of 45 psychiatric beds has been operational in University Hospital Galway. The HSE indicate that at no time since February has this bed occupancy level been exceeded, and that there is no pressure on physical bed occupancy at present in University Hospital Galway. Along with the increase in bed capacity, the local HSE has also improved clinical governance, putting in place 2 assistant directors of nursing and an additional 2 senior nurse managers. This is in addition to a range of new staff and services, including redeployment of nurses from Ballinasloe. The HSE point out that the clinical director, together with the nurse managers, conducts daily assessments on staffing requirements to ensure the safest possible service at all times. Staff in the acute unit at University Hospital Galway are confident that they can meet the needs of current inpatients and the needs of those referred for assessments. Following a recent Health and Safety Authority inspection, an action plan has been finalised by the HSE. The majority of the issues raised have already been implemented, and the remainder are being completed. For example, the safety statement has been reviewed and updated, and improvements are underway in relation to relevant aspects of staff training. I wish to assure the House that the Department of Health and the HSE are fully committed to improving quality and safety throughout all mental health services, and that this goal will remain the highest priority as regards both patients and staff. This objective is reflected in the major reconfiguration of mental health services in Galway-Roscommon, with approval for an additional 44 permanent staff at a cost of around 2.6 million, and the coming on stream of a new 50-bedded acute unit in Galway towards the end of next year. As was clearly demonstrated in the private members' debate held in the Dáil last week, which was unopposed by the government, we all agree with the fundamentals of a vision for change and wish to see services brought into the 21st century. In this context, the HSE addresses all genuine concerns, particularly quality and safety, while taking account of recommendations arising out of reviews of mental health services at local level. We will continue with this approach so that all involved have an appropriate and meaningful say in modernising services across all regions of the country. And indeed, it is a feature now that we have client engagement in relation to the new units that are being put up around the country. I just want to make one last point, if I may, that patient safety was the priority in the HSE service plan for 2014, and that applies in our mental health services as well as everywhere else. So, thank you.
Deputy, you have a minute.
The Minister
Or
for...
two minutes, sorry.
Can I thank the Minister for his reply? Minister, you're saying that there isn't pressure in the unit at present. The difficulty is, Minister, that beds are being moved out of the ward when you have serious rain, and those beds are being moved back in again at other times because of pressures on the physical space to actually provide for the 45-bed capacity in that unit. I understand that on one occasion in the last number of months, men had to be accommodated in part of the women's ward because of pressure on bed numbers. Now, Minister, you point out that the clinical director, along with the nurse managers, conduct a daily assessment of the staffing requirements. If that's the case, Minister, I'm told by the nursing union there that 3 weeks ago, on one particular shift, there were 8 staff on the floor, 2 of whom were pregnant, and the other 6 staff had no restraint training. Do you believe that that's a safe situation? 2 weeks ago, Minister, there were 2 female staff managing the men's ward, one of whom was pregnant. There was a serious incident and the alarm had to be pressed. and patients who were being specialised had to be abandoned to respond to that particular emergency at that time. And these are specialist patients that require one-to-one support because they're either a risk to themselves or a risk to other patients in that unit. Now, Minister, we were told that you're told that the health and safety audit, that most of the actions have been completed. Clearly that isn't the case in relation to the incidents that I have raised. The leaking problem in that facility is still there. And Minister, last year we were promised that there would be home-based treatment teams put in place. That hasn't happened. We need those immediately in Roscommon and in Galway City. The 50-bed unit will take another 18 months to be put in place. And can I ask you, Minister, as an interim measure, open the state-of-the-art St Luke's unit in Ballinasloe, take pressure off Galway University Hospital, pending the completion of that new 50-bed unit.
Minister, you have 2 minutes.
Thank you very much. Well, just to thank the Deputy for raising the matter again. There's no question or doubt that historically the mental health services in this country have been the Cinderella of the health services. I had the pleasure of opening a new psychiatric unit, acute unit in Beaumont Hospital last Friday, something that we've waited over 25 years for. And you know, when they built St Dita's, it was a state-of-the-art engineering feat that appeared on the front of the International Engineering magazine back in 1902 or whatever it was. But I would know from information gleaned from working in that institution over many years as a visiting GP that the original intention was to build that hospital on Lambay Island, out of sight, out of mind. The further away, the better. So the next furthest point was the peninsula at Portrane. Thankfully, we live in much more enlightened times. The government's policy is to remove the stigma from health care relating to mental health, and all new primary care centres now have mental health facilities associated with them. And indeed, the new unit in Beaumont is a joy and a delight for the patients, and the unit is in fact named after an individual, Mr. Sheehan, who was one of their long-standing clients. So the whole approach has become much more client-orientated. The Deputy has raised some points that he believes still apply, and that being the case, I certainly will come back to you in relation to the status. It would not be acceptable that there is a leak unfixed and have patients in that scenario. It does take time to build new facilities. We are moving away to a new model of care, which I'm sure the Deputy agrees with. We want people kept in the community insofar as is possible, and we do need to transfer staff to the community to do that. Community facilities are more appropriate, not necessarily more cost effective, but it's best outcomes for patients we want. So that is our focus, and a lot of extra money has gone into our mental health service, and rightly so, and continues to be the case. So I would certainly undertake to check out the areas that the Deputy has raised concerns about and revert to him in writing.
Thank you.
Thank you.
Minister.
And can I take the opportunity to thank, as I did in Beaumont, I made the point that, you know, we had the terrible situation where patients were in large rooms with paint peeling off the walls, but getting excellent care, moved to the palatial surroundings of the likes of Leeds Cross, where the care was not good at all. So it's to do both, and to congratulate and commend and thank the staff who do such a great job looking after some of the most vulnerable people in our society.
Thank you.